Good morning, everyone. Let's start with the storytelling presentation on carotid cavernous fistula. So, my patient, 20 years old male, resident of Ghaziabad, Hindu by religion, came to me with complaints that doctor, my left eye became red and bulging, and I can even hear a sound inside my head. The exact timeline of events were 4 months ago, it was an RTA. 3 weeks later, it was followed by left eye redness and progressive protrusion. 2 weeks after, patient feels the eye is throbbing like a heartbeat. And presently, there was severe headache with decreased vision. The detective clues in our inspection were 6/60 visual acuity in left eye and abaxial proptosis of the left eye. On visible pulsations over swelling were present. प्ले नहीं होगा तब वीडियो प्ले करनी है. There were visible pulsations over the swelling. Dilated episcleral vessels were present with raised IOP and ophthalmoplegia. On palpation, there was a 4x4 mm upper lid soft cystic compressible mass with no resistance on retropulsion, palpable pulsations, and size increasing on Valsalva. By Rouleau method, 16 mm was right eye and 21 mm was left eye. On auscultation, bruit was heard over the swelling. Fundus left eye showed hyperemic disc with tortuous blood vessels. On investigations, MRI showed enlarged SOV and MR angiography showed the abnormal arterial venous connection. DSA was done, which is the presently gold standard diagnosis. This is the MRI and this is the MRA. The classical signs which caught our attention was the pulsatile proptosis, the dilated episcleral vessels, and the audible bruit. And the diagnosis which we made was left carotid cavernous fistula of direct type. So the major differences between the direct and the indirect CCFR, direct is usually followed by high flow, post-traumatic and more dramatic. And indirect is low flow, spontaneous with subtle presentation. We referred the patient and the management was coil embolization using endovascular technique. The outcome before versus after was, before there was severe proptosis with dilated episcleral vessels and bruit, and after embolization, the proptosis decreased, the bruit disappeared, and the vision improved. This was the post-intervention image. The take-home messages are, always suspect CCF in patients with sudden proptosis and bruit, and ophthalmologists are often the first to detect it. Endovascular therapy offers excellent prognosis. Thank you.